Good afternoon, everyone, and welcome to the first in what's going to be a three-part series focused on back to the workplace issues, specifically safety. My name's Jay Nuss of Jay Nuss Realty Group. We're based in Braintree, and I'm going to serve as the moderator for today. So our panel of experts include Kim Croa. Kim's an attorney with Baker, Braverman, and Barbadoro, based in Quincy. We also have with us who will speak after Kim, Jane Estella. She is a commercial space redesign architect. She founded her firm, Adios Architects, in 1994. And last but certainly not least, part of the program today is Dr. May Riyad, who's affiliated with Harvard Street Neighborhood Health Center in Dorchester, Mass. She is also board certified in internal medicine. So in terms of the today's format, Kim and Jane will present their subjects for approximately 10 minutes, and we're certainly not going to hold anybody to an exact time, but we absolutely promise to have everybody out and finished probably within 50 minutes to an hour at the most. So they're going to present, and then we're going to have a question and answer period after each speaker. And depending on how many questions we see in the chat box, we'll pick probably the most popular or dominant question, and we'll have the speaker focus on that. And as we've said in the invitation, we promise we'll follow up with any and every question that we see in the chat box, and we'll make sure the experts will address those in an email to you. So the presentation will be recorded. And the second part of the series will occur on Thursday, June 18th at 4 p.m. I'll now begin with Kim. So Kim, if you're ready, without any further ado, I'll turn it over to Kim Croa.
All right, thank you, Jay, and thank you to Jay and the Jay Nuss Realty Group team for putting together this presentation. I think there's going to be some good information from a lot of different sources, and there's seen a lot of online virtual programs out there, and this one's different from all the ones that I've seen. So I'm very excited to be a part of it. Thank you. So jumping into it, can you believe it's been 3 months? Almost 3 months we've been virtually shut down. So I'm going to talk about a few things. The initial phases that were set out by the state back in May, and then the guidelines and requirements. I'm going to focus on offices, but as I'll get into, there's a lot of different themes and requirements that are quite consistent amongst different industries. And then at the end, I'm going to talk about some best practices that you might want to consider. So I have a slideshow that I'm going to start, if I can do this right. There we go. All right, so going right into it. This phased approach was put out in mid-May, and all of the slides that are shown here are all available on the mass.gov website. They really have a great resource of a lot of different information, some of it checklist, some of it detailed, but it's a good place to go to for specific information. So they're here for reference. I'm not going to go through them in detail, but I want you to know that mass.gov, it's a good place to check out. So this sheet was released by the governor in mid-May, and it lays out the different phases. Right now we're in phase 1. So what does that mean? We had the initial essential business, which was somewhat in flux. You saw the restaurants doing takeout. You saw some offices open for essential, but very limited capacity. Phase 1 came out, and they allowed more offices subject to restrictions, as well as lab space, limited personal service, some additional retail spaces that could open. And then phase 2. Now the phase 2 people were given some surprises this week, I think. They essentially made a phase 2A and a phase 2B. So the phase 2 in general has retail being able to be open for customers to come in, restaurants to be open, and the governor basically broke that into 2. So in A, there can be outdoor seating, in B, there can be indoor seating. We have lodging and personal services. So that's a big one that they broke into 2 categories, and I think a lot of personal service companies were quite surprised about that. Whereas looking at this mid-May, you thought you'd be open at the start of phase 2, which could be as early as June 8th we haven't heard for sure when phase 2 is going to start. There's a host of metrics that seem to be going in the right direction, but the governor hasn't given guidance on what that's going to look like. So the first part of that is far touch businesses, photography without close contact. The part B will be massage, really your spa type services, your eyebrows, nails, whatever it might be that you're close, that's not cutting hair. Hair has been allowed to come out so far. And then phase 3, you have some additional openings that are allowed. And again, this somewhat changed a little bit. Bars and beer gardens that don't serve food were both put into phase 4. So I'm going to go right into the regulations. So there's a few things that businesses need to do. There's requirements, there's guidelines, and then there's best practices. So one thing that the state is asking all companies to do is to take this checklist here and have the employer sign it and basically post it up front as a promise to customers that they're going to do these things. They're going to make sure that their employees are wearing face coverings anywhere that they might be in contact with the customer. They're going to be providing hand washing and hand sanitizing areas, and that their employees have been trained on what they should do, and that there's cleaning procedures in place. So, so this has to be signed by the employer, and one of the things that we're recommending is that employers also have their employees sign this. This doesn't go anywhere, you don't turn it into the state, but it's a way to have the employer go through, recognize what the requirements are, sign it, ask their employees to do the same, that they'll live up to those things as well. So, flipping over to the next one. And this is the control plan. So again, this is another item that the state is asking offices to do, or any business to do, and that they should fill out this form to outline what they're going to be doing in their office to make people safe from coronavirus. Again, this goes in its own files. It doesn't get turned in anywhere. So what are the requirements? What do companies need to do? Well, there's a lot of requirements. So again, there's a lot of themes that break apart for different industries. There's offices, retail, childcare. There's a lot of different guidelines that came out on Monday, but there's a few things that are fairly consistent. And that's that there's reduced occupancy levels. So maybe you don't know what your occupancy level is. You can reach out to your town or city, find out what the occupancy level is, and then back into it there. For example, offices have a 25% maximum capacity, except there's a caveat to that. They can have more than that if it's essential to a business, essential for public health or public safety. That's clearly a lot of loose things that can go into that. But what does that mean? Well, if you have employees who have been working at home for 2 to 3 months and they've been effectively doing that, it's probably not going to be essential that they come in. But if it has not been feasible, if that relationship hasn't been working, then that's a different situation. As far as the space is concerned, there needs to be 6 feet of separation between everybody in the space, unless there's adequate protection measures put into place. And that's where Jane's going to come in quite a bit. But what you're seeing is that there's partitions. Those could be glass. They could be plastic. They could be shower curtains. They could be a lot of different things. But you want to have separation between employees or customers, whatever the case may be, if they can't be 6 feet apart. And so you're going to have common area issues, elevators, places where people typically congregate. Maybe there's a break room or a seating area for lunch. And so you want to try to get a rotating schedule so not everybody's in there at once. Attempting to maintain the 6-foot spacing between people. There's requirements for one-way traffic through different businesses where applicable, and signage. One of the other big things is signage. We talked about the initial welcome poster earlier, but some other things that are required are reminders. If it's an open space where the public can come in, reminders that they should be staying 6 feet away from people on a regular basis. And that we should try to reduce things that are frequently touched. So what does that mean? That could mean copy machines, doorknobs, whatever it might be. The employer is required to sanitize and thoroughly clean the site once a day, and to frequently clean the items that are touched a lot. And going with that requirement, they also need to make sure to provide cleaning supplies to the employees. So hand sanitizer should be available. We talked about a hand washing facility with soap, but employees, if they're walking through the space, should be able to clean up the areas that they touch on a regular basis. And the employer should make sure that at least daily, the office is getting thoroughly cleaned. Let's just see. So the common spaces, we talked about reconfiguring. And another big requirement is that one of the big items that they've shown for trying to get out of some of these strict requirements is tracing. So businesses, and this is all businesses, not just offices, are required to maintain a log of who comes into the space. Now that's employees, that's customers, that's if you're having mail dropped off in your space, that's the mail person is checking in. So that if there's a positive test, the company is required to inform their local board of health about the positive test, and then the Board of Health will work with them in notifying people who have come into contact. So with that, there's a couple things that come in, and I'm gonna kind of merge together the best practices. I'm running over the 10 minutes, so I'm gonna merge together a little bit the best practices and the requirements. So the requirements is to encourage employees to stay home. If an employee appears to be sick, then the employer can also require that they go home. They can send them home, pay them for the time that they're there if they're hourly, and then send them home. The caveat to that is that the employee can seek unemployment if they've been sent home because they're sick. So one thing that we recommend is staggering shifts. Say you have 14 employees. We'll have 7 of them come in Monday, Wednesday, Friday, and the other 7 come in Tuesday and Thursday. That way, if there's a positive test, all of those people are going to be asked to stay home and self-quarantine. And so that way you're not losing your entire staff. You're only losing half of your staff. Just see, I think there was the sick days and the logging. So, oh, the last point I wanted to make, enforcement. What do we do with all of these? None of this information gets turned into the state. The AG's office has opened up a hotline. So if an employee sees an issue, they can call the hotline and report it. Both state and local officials, Braintree officials, and state senators have come out, and I'm sure there's others, but those are the ones that I've heard, and said, we're not looking to go after companies for this, but we're hoping that they are going to go along with this and not cause a problem. But if somebody misses something, then that's not the goal. Is here education and not punishment. So the other caveat to that is that if the business has been open as essential, they really have until July 1st to comply with these. So if everything is not 100%, they still have a few more weeks to try to get in line with these requirements. And if anybody has any questions, as Jay said, we'll answer them at the end or by email if we don't have time today, and feel free to reach out to me as well. These are additional safety standards on there. And mold, sorry, the last point. If the space has been truly closed, then you should take a look at whether or not there's any potentially hazardous issues that have taken place in the space. But there's guidance from CDC on what to do about that. It seems like a lot of the offices around here have at least had people in and out of them, so that may not be an issue, but if it is, it's something to check out. So thank you all very much.
Thank you, Kim. So Kim, a question?
Yes.
One of the questions that has come up before, and it wasn't necessarily addressed today, and that was on forgiveness. Mm-hmm. And it's the lease versus tenant at will. So my understanding is, in order to qualify forgiveness for the rental payment, you actually do have to have a written lease. Yet there are various companies who have reached out and they don't have necessarily written leases. They may be tenant at will, 30-day. The lease started 5 years ago and maybe it ended last year. before February 15th of 2020, yet they still continue to pay rent based on the original lease terms. The question that's been arising is, will that kind of a situation qualify for forgiveness or not?
Are you talking under the eviction moratorium?
No, under PPP forgiveness.
Oh, that I am not sure. Sorry, when I was thinking that had to do with the eviction. But no, I'm not 100% sure how that works, but I can look up that answer and get back to whoever's on here with the response.
Okay, great. Any other questions for Kim? Okay, well, thank you very much, Kim.
Thank you.
So I think Jane is still in the audience. Jane Estella.
Yes.
Our next speaker will be architect Jane Estella. It's all yours, Jane.
Hi, everybody. We are an architectural firm that specializes in commercial office space, design, some retail, so on and so forth. We would love to get you the opportunity to be aware of some of the issues that you're going to be looking at. We know that offices have been available to open on I believe it was the 28th of May. Boston was able to open up June 1st. And again, like Kim said, that was with a 25% occupancy. I had read somewhere else that they had said that if you had a different amount of workers, different than what the business building codes allow, that you could have 25% of that. But I'm not saying that you should if it exceeds, for instance, office space allows for 100 square foot per person. So if you have a 5,000 square foot office, you're allowed to have 50 people. 25% will only allow you to have 12 people. So like Kim said, it makes a lot of sense to have people stay at home during that time. And I like her idea of staggering people different days so that people can come in. A lot of people do prefer the office environment to home. I've been kind of taking a poll on that. But, we know that the state has developed the mandatory workplace safety standards. So I'll be touching a little bit on that. But first I wanted to cover why should people or staff, employees, whatever, why should they come back to work, to the workspace versus working from home? And this is what a lot of people feel. So I'm not saying that this is necessarily the exact issues that should account for it. Some people feel that they will be more productive because there'll be fewer distractions than if they stay at home. And that allows for focus and creativity. Another one is to have a rapid decision-making situation where you can innovate and develop new ideas and benefit because you're working with other people in an office environment and you're not relying on the technology at the time that is available to us. This is also allowing for some people would prefer to streamline communications. And by, of course, replacing emails, calls, virtual meetings, and so on. Just having someone right there to be able to talk to and brainstorm with. And another reason to come back to the workplace is obviously for the physical work and required tools in a lot of cases. Because sometimes people need to have access to equipment, testing, data infrastructure, and also people want to have more access to computer power, monitors, printers, copiers, and files. And then to physically work, obviously in labs, command centers, manufacturing, people need to be back at the workspace. Now on the other side, why stay at home? And for a lot of people, they feel they're more productive at home. And sometimes because the team can't be together, they can focus on their own situations. And it's easier to work remotely with synchronous communication flow between the entire team using current technology tools. A lot of people feel that their focus is easier, and a lot of people would prefer to reduce the time in commuting. And another issue for them is they'd like to stay at home because of individual health and personal situations. Some people would have personal health risks exacerbated by commutes, anxiety from being at the office, or mentally not being ready to come back. Also, certain people are in a situation where they have lack of childcare and elder care. And another one finally is to minimize commuting costs, and of course time. And I would like to cover the issue that, for instance, an employee wants to return to work, or their employer wants them to return to work, but they're worried about being exposed to the virus. And you can tell them that they are entitled, the workers, the employees are entitled to a safe workplace. It is the employer's legal obligation to provide it, and especially in a pandemic. And what's meant by a safe workplace? The workplace must be free of known health and safety hazards. So the workplace must be free of known health and safety hazards. This is from the Occupational Safety and Health Administration, also known as OSHA. And they enforce the federal law on workplace safety, as I'm sure many of you know. And depending on the job, that could mean you would need to have physical barriers such as clear plastic sneeze guards or panels, and changes in the way the business is conducted, for instance, drive-up windows. Another issue is improving ventilation and added air filters, and of course, added hand sanitizers. Now, OSHA has classified workers into 3 risk categories. The healthcare workers that have already been working for the most part, they were at a high risk of exposure to the virus. Teachers, restaurant and retail workers, and mass transit workers are deemed to be at a medium risk. Office workers are considered at a low risk. And finally, we should remind ourselves that the workplaces should provide supplies to allow for frequent hand washing and regularly sanitize, as Kim said, the high touch areas such as workstations and doorknobs. And also, as Kim said, there is a hotline. I'm not aware of which one that is, but I know that I also read that employees and customers can report unsafe work conditions to the Board of Health, the labor unions, and this hotline. Now, businesses need to be self-compliant and have self-enforcement of these new health standards. Now, an interesting website that you can check out, which covers a lot of things that I would recommend, is especially for Boston, but it covers Massachusetts too and a lot. Boston.gov/business-PPE. That's boston.gov/business-PPE. Something to think about. Now, business buildings and occupant spaces should only be declared ready for occupancy after building owners management teams and tenants have coordinated and communicated on preparations. Transparency, ongoing communication, and awareness will be vital to a successful transition back into the physical environment. So we all have to be looped together and have everything in place before the workspace or workplace can get back to in running order. Now, social distancing can be, space planning can allow social distancing to reduce the transmission of the contagious diseases among colleagues at work. Solutions may differ depending on how many people are expected to return to work versus continuing to work from home. Understanding that dynamic will allow the calculation of the total workforce expected to be accommodated in the demand for workspaces. Now, as Kim said before, and I said also before, the limited capacity is 25% per code. And I also said, you know, in businesses, particularly office space, 100 square feet per person. And we can check into other occupancy types allowances for staff. Now, the circulation spaces we should think about. We designate and signpost the direction of foot traffic in main circulation paths, corridors, stairs, entries. And then we need to consider having a one-way circulation route throughout the workplace. And also to mark increments of locally acceptable social distance on floors where queues could form. Now, as far as individual seats, we should think of only using alternate desks like a checkerboard. We should disable the use of alternate desks or remove them altogether. We can add desks to spaces previously used for group activities. For instance, converting training and meeting rooms, cafe areas into desk areas, so we can spread them out. We can increase the space between desks. And when a 6-foot distance is not attainable, we can add panels. And like Kim said before, they can be glass, they can be plexiglass, they can be the kind of panels that we use made of steel and fabric. But these panels would need to be higher than a standing worker. So that's something to keep in mind. And we can specify seat assignments for employees to ensure the minimum work distances. And we should review sharing ratios if new sanitization protocols are introduced and disinfection practices. Now, meeting and shared spaces. We should decommission and repurpose large gathering spaces. We should reduce the capacity of spaces. For instance, remove some chairs from large meeting rooms. We should prohibit shared use of small rooms. In a situation where we have like maybe 2 or 3 people in an office, we have to convert that to a single occupant office. And then we should, in a lot of cases, close or forbid use of some rooms. Now, for instance, if we had a large room, for instance, 200 square feet, which is, I guess, medium to large, and we want to figure out how many people can be in that space, allowing a 36 square foot footprint, which is 6 by 6 feet by 6 feet, we would take the 200 square foot office divided by 36 square feet, and that would only give us 5 people. And that we have to communicate this capability by way of signage and room reservation needs. as Kim said before, we should stagger shifts and breaks. We could also consider, and we should have, a room to isolate a symptomatic staff member. Kim also touched on having the login for contact tracing. And for the operations of the workplace, individual desks should consider implementing a strict clean desk policy so that non-essential items are not stored on the desk, but rather enclosed in cabinets or drawers. And you have to impress this on all the staff, of course. And we can add a supply of disposable daily paper placemats for use at each desk, especially when they're shared, but every day too. If desks or work areas are shared, we have to advise the individuals to sanitize all work surfaces upon arrival. And we should supply disinfectants in the immediate proximity or on each desk. And unless stringent cleaning protocols are enforced, and if possible, avoid sharing of desks. As regarding in-person meetings, we should coach the employees to critically evaluate the requirement for in-person meetings. We should limit the number of attendees at in-person meetings and limit to spaces that accommodate safe distances. We should host large team or staff meetings by a video conference rather than in person, and eliminate in-person meetings with external guests. Now, final thoughts on this. We need to prepare the building. We need to prepare the workforce. We need to control access to the workspace. We need to create a social distancing plan. We need to reduce touch points and increase cleaning. And we can't stress this enough, but we need to have good communication so people can be confident in the whole situation. And another few thoughts, that people should be welcome at work, but always acting responsibly. We need to stick to the rules, follow the signs, stay safe at 6 feet from each other, walk the office clockwise, always and everywhere. Enter and leave meeting rooms as indicated. And replace your desk guard daily and leave a clean desk. So that's the critical issues that I thought I would share with you today. And if anyone has any questions, or Jay, you have anything for us, I'd be happy to answer those at this time.
Great. Well, that was very comprehensive, Jane. Thank you very much for that. Question did come up, and I don't think you did touch on it, with respect to elevators. Different questions came in with elevators actually handling as many as 4 people, 1 per corner. Is that realistic?
Oh, it really isn't. Elevators are normally about the average standard elevator, 6 to 7 feet wide by 5 to 6 feet deep. And the best recommendation for that is to have 2 persons in an elevator at a time, standing in the diagonal corners opposite each other. And as far as the virus being potentially living on the elevator buttons, that is true, that they can, and plastic and stainless steel both can live for 2 or 3 days on the elevator buttons in any, like I said, plastic and stainless steel anyway. So that's the situation with that. If you have a very large elevator, obviously I would say 4 corners would be fine. And also, if people want to make their freight elevator available. So that's usually bigger. Smaller elevators, I would be concerned with maybe having one at a time. Or a standard elevator, I would say maybe one wheelchair at a time, and that's with or without someone pushing them. Obviously, they're not going to be safe distancing if they're pushing an elevator, pushing a wheelchair. So unfortunately, that's the situation we're looking at. There's going to be long lines in elevators, and they will require marks on the floors or signs or whatever to keep people self-distancing when they're lined up in those queues. Okay?
And then Jane, one final question. One of the comments came in that they question, are these requirements or are they just state recommendations? Because some of them seem very extreme.
Well, they're pretty much requirements.
They're requirements.
Yes, because most of it, the social distancing has to happen no matter what. And like I said, if people are going to sit like out in an open space, desk beside desk, then they would need to put partitions between them. And all workstations really should be high enough to be taller than a standing worker, especially now that people like the option of standing as well as sitting while working. But also, if someone comes in and wants to stick their head in, or a person wants to look over a petition, they really shouldn't do that at this point in time.
Excellent.
So, but if you can keep people 6 feet apart, I think it should probably be okay without petitions.
Great.
Okay.
Thank you, Jane. Is Dr. Riya in the house?
She is. Doctor, do you want to unmute yourself? There we go.
It doesn't look like you're muted, but we still can't hear you.
Yeah.
She is unmuted.
Can you hear me now?
Yes.
We hear you, Dr. Riya, but are you hearing the echo, Steve? Okay.
She joined twice. I just muted the second one.
Okay. We can see and we can hear you, Doctor. Is she muted, Steve?
Yeah, it looks like she has two connections, and I think maybe one is audio and one is video. So let's try.
Is it unmuted now?
Yeah.
I believe it's unmuted now.
Yeah, now you sound great.
All right, excellent. Any
Okay.
questions from the audience?
Well, Dr. Riya, I'll step back just a second, just to make a formal introduction. And maybe if certainly one can see that you're with, Harvard Street Neighborhood Health Center, and would be curious, maybe if you could just give us an overview based on your experience on the front lines since the beginning of the pandemic.
So my experience is quite specific to working as an outpatient primary care physician.
Mhm.
So our clinic sees mostly the 80 to 85% patients who are lucky enough to have mild to, I would say mild to moderate cases where their symptoms are not severe enough and they do not require oxygen supplementation. They do not require to be hospitalized or monitored. So my experience was with, some of them were not all young. Some of them were in the, I would say the senior age group. Some of them were in the 60s, but very invariably, most of them were in their young adult to middle-aged groups. Most of them fared very, very well. Only a very, very minor percentage of these required to be in the hospital, most of them required 2 or 3 days of supplemental oxygen just through nasal cannula. They did not need invasive oxygenation, so they did not need to be intubated. They did not need to be in the ICU even. They did not need invasive oxygen. Most of these have been doing very, very well. Starting, I would say, end of most of May, especially end of May, we've seen a big percent of patients who are having appointments with us, requiring to go back to work and requesting letters to go back to work. So these were very, obviously very promising. And it all depends on what work they do and what requirements some jobs are, because CDC is giving us 2 options for patients to return to work. The one option is just through symptom-based, and the other one is the testing-based one, which was at first was not easy, as everybody knows. Obviously, testing was a problem, which it isn't a very big problem at this time, but it's still not ideal. The testing situation in Massachusetts is still not what we would like it to be. And the other one is the symptom-based. So most patients who are not going back to see patients, who are going back to different types of jobs, but they're not in healthcare, we could just go by their symptom-based, and we can give them a letter to go back to work. So that has been happening, I would say, for the past 3 weeks, which was very promising. And so far, we ourselves, we were the medical doctors and the providers, we were working from home. And next week, we are preparing now to reopen ourselves and to go by ourselves to the clinic and to start seeing patients more regularly. We are also using some of the suggestions that Kim and Jane have been talking about today. We're not going back full force yet, neither as employees nor as patients. We're staggering the shifts, as Jane was saying. We are trying our best to keep enough space and to ensure a very strict mask wearing throughout the time people are within the building. And there are some certain services or certain procedures that we will not be able to do. For example, like we wouldn't be able to give nebulizing treatment. Certain things we are still working on, especially with working on ventilation in buildings. So this is something that Jane, I believe, may have brought up also, that we have to think about updating ventilation, because most office spaces, there are no ways of opening a window and ventilating the spaces. So we are all sitting somewhere, breathing, circulating air. So that's one thing that we all have to be thinking about. Yeah.
You've been busy.
Yeah. So
Thank you.
most of us work. Okay.
Thank you very much for that overview, Doctor. So some of the questions that have come in, they're going to be, I think, pretty basic, but one that I've been getting and others have been getting is questions about the acrylic keys. Apparently, advertising specialty companies, manufacturers are selling the, I don't know if they're all one color, but I've seen it's a black acrylic key, and they're selling them by the truckload. And apparently it's to eliminate contact with certain touch points, whether it be a doorknob, an elevator button, whatever it might be. And the question is, how effective do you think these so-called acrylic keys are?
So the idea in principle makes sense, because the whole idea is eliminating touching the same surface that someone else has touched. I'm not sure if that is necessary in particular. Obviously, if this is something that you can do and you can afford, please go ahead. But the whole idea is, I think by now everybody's very well versed by what needs to be done, and very vigilant, just hand sanitizing. And so if you can do that also, so it's a relative option. I don't see it as necessary, but we will hear about a lot of ideas coming out these days. I'm sure people are very creative, trying to bank on what's going on. This is the first I heard of this one. Pretty interesting, I must say.
Well, thank you. Another question that's come up also is on the use of gloves.
So gloves is, think about it as a barrier. It's a barrier to your hand to touch someone else's germs. But the way that people are treating gloves or using gloves that I have seen in supermarkets and in grocery stores, that's not the purpose of. So the idea is the way doctors use gloves, or let's say a chef even. If you're mixing something that's dirty, or you don't want your hands to go into, let's say, garlic. I'm just giving a very, very simple example for people to, you use the glove, and then you get rid of the glove. As soon as I walk into a patient's room, I put on gloves to examine the patient and not have any of his germs, or let's say his or her rash, come on my hand. And then I immediately take off the gloves and wash my hands. I don't sit with the gloves that I had touched with the patient, or let's say the chef who was cooking, and then use that same glove to do a lot of other activities that will involve moving that germ, that virus from that surface or that. So if people use gloves the correct way that it was meant to be used, yes, gloves are effective because they are essentially a barrier. If people do not want to use gloves, which I understand that they shouldn't, they don't need to, they can just practice hand hygiene very, very regularly. And there are some ideas, I think it was in Star Market, where they call out all their employees at certain times, and they ask them to go and wash their hands now. I felt it was quite not a bad idea. Just like every 30 minutes, go wash your hands. So I'm not for gloves with the way I'm seeing people using it nowadays. And they use it with everything, and then they touch their face with it. So it defies the purpose. Yeah.
Understood. Okay. So if you're going to use it for a one-off purpose and then dispose of it properly?
I would say so, yeah. Use it. Let's say you're going to go to the ATM machine and you can't wash your hands right away. So this is a good example. You're going to use a shared computer, and then you're going to go back to your desk. So maybe put your gloves on, use the ATM machine, take off the gloves, and you also need to understand how to take off your gloves so that you would not be touching the dirty part, and then dispose of the glove, and then your hands are pre-glove situation. I'm not saying your hands are sanitized, because I don't know what they were before you put on your gloves.
Right.
Yeah.
Understood.
So I don't want people to think or to feel that having gloves on or having masks on is the ultimate shield. The ultimate is hand sanitizing.
Okay. What about disposing in the gloves? I'm sure there's a proper way to dispose of a glove.
There is. I'm sure there are very good videos. The whole idea is, I don't have any gloves on right now. The whole idea is when you're trying to remove it, not to touch with your hand the outer surface.
Right.
Yeah, and you know, there's so many videos explaining that. And the same goes for the masks. There should also, the whole idea is that the outer surface of the mask is the surface that has caught all the droplet from all the people around you. So we should not be touching it. We should not be touching the outside. We should be touching it from the inside, and you can remove it from the ear thing or from the inside. And then if you do touch it, you make sure that you do wash your hands.
Right.
Yeah.
Excellent. Maybe another question. It may be the final. We have just a few minutes left, and it's on testing. Somebody had posed a question that if they go into a lab for maybe just standard blood work, can they request, or is it even available, an antibody test or a test itself for COVID?
So in my clinic, and my understanding, this is what's going on throughout Massachusetts. I'm not sure about other states. What we rely on is the PCR, which is the nasal swab. The antibody testing is a very controversial test, and it's not, the use of it is not for you yourself to find out how you're doing or if you're positive or not. For the most part, the use of the antibody, the blood work one, is epidemiologic. So it's a way for, let's say, the city or the US to find out how many people were exposed to this, but it wouldn't be useful at the individual level.
I see.
The other one, the one that we actually would be able to tell if someone is positive or not, this is when I was earlier saying that testing is not ideal. We have it available in the clinic, in our clinic, as an appointment. You call and make an appointment ahead, and you come in and get tested. What's not ideal about it, and this is the whole of the US, is that it takes 2 to 4 business days for the results to come out. It would be most useful if in 2 hours I find out if I'm positive, which has been happening in other countries, but I'm not sure if this has been happening, let's say, in Washington, DC, and in other, but not in our, I don't believe this is happening here in clinics and in, so yeah, so you call ahead, you make an appointment, and we set you up to get tested.
Mm-hmm. Great.
Yeah, and you don't have to be a patient of our clinic for that.
Oh, excellent, excellent. Well, thank you very much for that, and thank you for all you do, Doctor, on the front lines.
Thank you.
And as we had mentioned earlier, certainly if anybody has further questions, we took as many as we could. Put them in the chat box, and we'll certainly have the presenters get back to everybody via email. So again, I thank you for all attending, and I thank Kim, Jane, and Dr. Riyad for presenting. And we look forward to seeing everyone on June 18th. And it won't be at 2 o'clock, it'll be at 4 o'clock because of too many Zoom conflicts. So June 18th, Thursday, 4 o'clock. Thank you very much again.
Thank you.
Well,
Take care.